At the first of our new speaker series event, we took time to capture some of our colleagues' views. Questions were asked about the value of the speaker series, colleague expectations, and ways in which thinking was beginning to be challenged. So sit back and take a few moments to listen to what others have to say.
This is the third speaker series session I've been to. I would encourage everybody to come and give them a try. I think it's often good to hear people who've not even necessarily heard of their organisation. I've learned quite a lot, and often, more than that, I often think it just makes me think, to reflect back on the way I'm working and synergies with what the person has said, and I usually go away with quite a few things written down to look up. So yeah, anybody who's not been so far, I would encourage to come and give it a go. And the shortbread is lovely.
So my expectations of today's event was to be challenged in terms of how we think about health inequalities and life expectancy, and in particular how our work influences and impacts on that. What I've taken away so far from the event is really stuck by Sarah's comments about the narrative and how we frame a conversation, and I think that's a real challenge to us as we work with complexity and really kind of complex ideas, and how we make that something people can engage with at a level that people really genuinely understand and interact with that data and information in a way that actually drives change in policy and direction. So I'm really thoughtful about how we talk about those issues and how we get people to engage with these issues. That's my takeaway from today.
For me, it was really reassuring to hear about the way that Carnegie thinks about any cause, hear how Sarah was talking and about the approach that Public Health Scotland is taking in our way to improve life expectancy across Scotland and a Scotland where everyone thrives. It seems that we're on the right course, so I look forward to taking this work.
So I find these sections really stimulating because it gives a bit of space and time out of the office to do a bit of thinking and a bit of reflection both on the work of my own programme and how it fits organisation within service, within our own direction and more widely across organisation. So it's really space to think.
From coming to this session today, really interested to hear more about the work of the Carnegie Trust. I've heard Sarah speak before and just really extremely passionate about what they do, so that was my idea for coming today.
In terms of how my thinking has changed since hearing the first part of the session, I think it's not necessarily changed hugely, but it's more reinforced a lot of the important messages I think that we know within Public Health Scotland around the value of working collaboratively with others and in partnership, and the importance of good data and evidence. And I think of storytelling as well, and just the reflections that we've heard around being able to communicate what we do effectively to others is an important learning point.
I think what resonated most for me was the importance of our role as part of the broader system, and that we cannot and should not expect ourselves as an organisation to be able to achieve anything on our own. It is through the collective efforts of a lot of people with a coherent narrative, working collaboratively, bringing their own unique contributions, that's going to lead to long-term sustainable change. And it's helpful to hear an outside perspective that helps to support what our organisational thinking is in this.